Hi there, my name is Dr. Kim Graham, DrTCM, and I'm here to talk to you today a little bit about the clinical record keeping course for TCM professionals that's going to be hosted by Eastern Currents. A little bit about myself. I've been practicing since 2002, more specifically in addictions and mental illness. I've developed a number of programs for Vancouver Coastal Health, and most recently I've been working at a sport and rehabilitation center located in North Vancouver, where I've had the opportunity to work with a diverse population, including elite athletes. And I'm really excited to be here today to offer the program that I've been teaching live at Langara for a number of years already online to reach a wider population. So a little bit about the course. Clinical record keeping is part of our responsibility as healthcare practitioners, and it's really designed specifically for TCM professionals, and it's based on the standard of practice for all healthcare professionals in BC. Anyone from a student or a beginning practitioner all the way up to a seasoned practitioner should be taking this course. The reason being that if you're a student or a new practitioner, it's really going to lay the foundation for you for appropriate records and a successful practice for your future. For returning or long-term practitioners like myself and others, this is a really great refresher. The longer that we practice, we tend to pick up some bad habits, and this is a good way of kind of returning us back to the focus of good record-keeping practices, and will ensure that any issues that may arrive in the future can be easily dealt with because you'll have the information behind you. So some of the specifics of the course that we're going to be going through, as you can see to the left of the screen here, are things like I take time and go through proper consent as well as medical intake examples. So there's been some issues I know in the past about what is a proper consent, how does that look. So we're going to take some time and go through that, as well as things like storage and disposal of your records, a lot of the legal questions that come up, how to chart appropriately. What do you need to have in our clinical records? What is required by A, the CTCMA, and B, as a healthcare provider in British Columbia. So because I've taught the course live for a number of years, a lot of things have come up. So I'm going to share some of the questions that we've had in the past, as well as my own clinical experience that can shed some light onto what can and should be happening, and sometimes what isn't happening, and the problems with that. So, you know, record keeping seems straightforward, and it should be. The other things that I'm going to cover are issues associated with MSP. So earlier on in the year, I was appointed to the Ministry of Health for the Special Audit Committee, and so through that process I've learned some very valuable information about how our records can be improved. So we're going to definitely discuss that as well. And I just want to reiterate, you know, it's not just the TCM professionals that are required and expected to review and improve on their clinical record keeping skills. This is a practice that is common and standard within the health field. Nurses and doctors have to continually review their practices and are required to take courses just like this. So, you know, we are actually bringing our practice and our profession up to the standard that is expected within the healthcare field. So the other piece, of course, is that this workshop is eligible for 4 continuing education credits with the CTCMA under Ethics. So it's a very important piece for all of us to renew our licenses every year, and I encourage you to join me in February for the live webinar and I look forward to seeing you then.